Good evening, all. Good evening. Yes, I'm just looking at my stream in front of me on the monitor. Okay, it was green at first, now it's orange. So I hope it clears up and that it gets a very strong stream. Okay. So it's still orange, but I'm going to go for it. Yes, good evening, and welcome to my new channel. This channel name is Sunset Journey. This is going to be my second video for this channel, and this will be also my second video, but my first live stream for this new channel of mine. And I want to talk about, and I hope my I hope my audio is good. Yeah, I'm looking at the bar for the mic, and it seems to be going along okay. Well, as well, again, this is my new channel, and this channel will be discussing my journey. Well, it's not really new, but new for the person that this journey is entailing. Yeah, as I mentioned in my first video, um, I learned about a week and a half ago that my mother has cancer, breast cancer, and it was just a fluke, just by chance that it was discovered. Yes, my mother goes for her regular woman's exams. My mother is 90 years old. In my opinion, I think, overall, I think she's doing really well. She's ambulatory, meaning she can walk unassisted. She could talk. She can do some basic things, but um, things are catching up to her, and so she does need supervision, and I'm a little sad about that. But overall, she's a spunky woman, and I think she has a lot of go in her. But some days aren't as good as others. But overall, I think she's pretty good, and I go to visit her, and we sit down. We watch TV, and the last time I saw her, we watched Judge Judy. She seems to like that. She seems to like intensity in what she's watching. But either way, we watch Judge Judy, and I bring stuff for her to eat. Some days, she forgets. Like, she has memory problems, and so she has dementia. And again, it's only during in an autopsy can you ascertain whether it was actually Alzheimer's. Only in post-mortem could they really determine through the autopsy. Either way, whether it's just dementia or Alzheimer's, the person's memory and their ability to think linearly is greatly compromised. And it's sad because my mother is a very, very independent woman. She married, and she had 7 kids, and she was a housewife. And then when we got big enough, older, she worked also. And then my father had passed away. This year would be actually 10 years since my father's passing. So for close to 10 years, my mother lived alone, and she managed the house for her. And so the house is it's too big for one person, and for her to adequately, really take care of the house. But again, I don't blame her for wanting to stay at the house. She's comfortable with it. And so with this channel, I want to I want to keep it natural, laid back. It's really just explaining my journey. I want to give, my family, their privacy. So this Sunset Journey, as I call this channel, is really about me, how I'm managing, what I'm learning about with the process. With my father's passing, I wasn't really involved in his life at that time. We didn't get along. Well, I should say I didn't get along with him. But I did go to visit him the day before his passing and the day of passing. I was in the room with him when he transitioned, and I was his last voice that he heard, and I was telling him stories, because they said in that final hours, the only senses that you have still available is your auditory. So I spoke very softly and talked to him, you know. So that's what So I was there, and I'm glad that I was there. It was a good it it released a lot of stuff. But either way, so my mother was diagnosed with cancer, and so today, me and some family members went with my mom for her follow-up visit from the surgery. She had the lump in her breast removed, and when they did the biopsy, they saw that it was positive for cancer. The lymph nodes under the underarm was negative, and they said that it was a stage 2 cancer. But when we went to the doctors today, they examined the breast. I think he examined both, even though it's just one of the breasts, the left breast. We learned that it was an estrogen induced cancer. Yeah, that was something, because my mother is 90 years old. And so you, as a woman at that age, way past postmenopause, way past menopause, you don't have much estrogen. But this cancer, they're saying, was estrogen influenced. So the estrogen triggered this cancer. I don't know how that could be. I don't know. I'm wondering whether medications could. I'm sorry, but my nose is itching. I don't know whether or not any medications could induce the rise in estrogen levels. That would be interesting to find out. So anyone who's watching this live stream, let me know if you know whether or not estrogen, whether any, yes, hello viewer. Yes, I want to know whether any estrogen could feed any cancers. So that's one thing that I learned. And let's see what else. The doctor also mentioned about treatment. Now, I don't think that my mom wants to get the surgery, because the doctor said, you're the one that has to go through the pain. And so it's something important for you to determine what you want to go through. So, whether operating of the breast, whether that's an option for you. Because, almost forgot, that when they did the biopsy, like they cut around the tumor, okay? Now you're hoping that they cut enough out and that they get everything. And so what they do, they check the edges of the tumor. Let's say this is the tumor. And so they check on the very edge and check the cells of the edge of the tumor to see if there's cancer at that edge, because they want to try to get as much as possible and get a good sample, good taking of it. But sometimes it still has cancer on that edge. That means they didn't cut enough out. And so in her case, they did not cut enough of the around, the surrounding part of the tissue. So that means she still has some cancer cells left in that breast that they removed the lump from. So they have to determine what would be the, because of her age, she's 90 years old, and they want to determine, okay, what are they going to do? So um, they the doctor suggested, because I think my mother, or my one somebody said, if I were the mother, if the doc if my mother was the mother of the doctor, what would you advise her? So the doctor said uh, to take these medications. That it is her option to take to remove more of the breast tissue, or to take these pills. And so I want to go online. I'm going to mention the two names of it's one or the other. You don't take both of them, but they could prescribe these medications, and they're designed to decrease the estrogen levels of your body. So it's called letrozole, and the other is tamoxifen. And so I don't know I've never heard of these. And so what I'm going to do with you guys, I am going to go on the internet, and I'm going to share, I'm going to go online to check out what these drugs can do. So I have my monitor here, my computer. Okay. And I'm going to type it in. So I'm going to switch the screen. Let's see here. Okay, so you're going to still see my face, but it's going to be a different screen. Okay. So what I'm going to do right now is to type in the terms, the name of the drugs. So the first one is letrozole. And we're going to discover together what this drug is. This is one of the two drugs, and we're going to see what it does. Okay, letrozole. Okay. Yeah, so the name is Femara. Letrozole is a non-steroidal aromatase inhibitor, meaning it lowers estrogen production, used to treat breast cancer in post-menopausal women. Femara is often given to women who have been taking tamoxifen. Okay, that's the other drug that they recommended, and they give the two other names that it's known for 5 years. Femara is available in generic form. That means cheaper. Okay, so interesting here that, okay, it's one of two medicines that the doctor suggested, but it says that it's often given to women who have been taking tamoxifen. My mother never took tamoxifen, so it'll be interesting why he's asking about that. Okay, let me see anything else here. Hormone-based chemotherapy. It can treat breast cancer. Okay. Okay, let's read what this says. What does letrozole do to the body? Letrozole lowers the level of the female sex hormone estrogen in the body. Estrogen stimulates some breast cancers to grow. Letrozole is a type of drug called an aromatase inhibitor. It blocks aromatase so that it can't change androgens into estrogen. Okay. What else? Let's see here. How does letrozole help with fertility? No, that won't be that in that case. My mother's not into fertility right now. She had 7 of us already. Okay. Yeah, is letrozole a chemo drug? Okay, it overhead said yes, but let's read further. Femara is an aromatase inhibitor approved by the U.S. Food and Drug Administration, FDA, to treat postmenopausal women diagnosed with hormone receptor positive early stage breast cancer right after surgery, or possibly chemotherapy and radiation to reduce the risk of the cancer coming back. Okay. So hormone receptor positive. Okay. Okay. So here, as I did mention earlier, that it was the type of cancer is positive for being estrogen induced. Okay, so I guess that's what that means. Hormone receptor positive. Okay. Let's see. What are the long-term side effects of letrozole? That's good to know. Let's find out together. Okay, uses. This medication is used to treat certain types of breast cancer, such as hormone receptor positive breast cancer in women after menopause. Side effects: hot flashes, hair loss. He did mention that, hair loss. Joint, bone, muscle pain, tiredness, unusual sweating, nausea, diarrhea, dizziness, and trouble sleeping may occur. Okay, so it acts like severe menopause, like even though my mother is menopausal, she's 90 years old, but I guess that even though you're menopausal, there's some, I guess, residuals of some low amounts of estrogen, so but it's still low. So it's just removing even what you do have and causing those interesting joint and bone and muscle pain, because I get my joints start to feel very stiff. I've been menopausal for 4 years, and I find that as I get older, as I get older, I feel stiffer. Things I used to do, and it just, yeah, you feel it. Okay. Dizziness, I sometimes get the vertigo. Let's see this. Precautions and interactions. Okay, there's nothing on that. Let me see. Is it better to take letrozole in the morning or night? Let's see. Okay, it's taken once a day in tablet form. The pills are taken at the same time each day, either in the morning or at night. Always take the pills exactly as your nurse or pharmacist has told you. This is important to ensure that it is working as well as possible. Okay. Can you drink alcohol with letrozole? Okay, my mother doesn't drink. What drugs interact? Oh, that's a good one. What drugs interact with letrozole? Okay, wow. I'm not going to even attempt to try to pronounce those words, but it's there. Okay, you could read and research these drugs for you for your edification. Let's see what else there. Okay, common side effects. Okay, we'll take again. Yeah, so it's the same as before. Okay, you see there the hot flashes, the hair loss. Okay. Oh, this is a good question. Is letrozole better than tamoxifen? Okay, those are the two, the other drug is the other choice that the doctor suggested, but my mother has to make the decision which one she wants to take. Let me see. The aromatase inhibitor letrozole is a more effective treatment for metastatic metastatic breast cancer and more effective in the neoadjuvant setting than tamoxifen. We compared letrozole with tamoxifen as adjuvant treatment for steroid hormone receptor positive breast cancer in postmenopausal women. Interesting. Okay. Okay. How soon do you ovulate after taking letrozole? I don't think my mother's gonna ovulate. No, let me see. Do you have to take letrozole at this? Okay, that's it. When should you? Okay. Oh, this is a good one. Can letrozole cause liver problems? Very good question. Let's see. Letrozole, on the other hand, have been reported to cause elevated liver enzymes in up to 1% of women. To the best of our knowledge, this is the first case of drug-induced autoimmune hepatitis secondary to letrozole. The risk of recurrence of hormone receptor positive breast cancer continues indefinitely. Okay. That was a good question. Anything else here? Oh, this is a good one. Can letrozole cure cancer? Very good question. Letrozole may also be given along with the target therapy drugs ribociclib, I can't even pronounce that, and this other drug when breast cancer has spread to other parts of the body. Okay, letrozole is also sometimes used to treat breast cancer in men. Okay. Does letrozole raise blood pressure? Let's see. Heart disease. This medication may increase the risk of heart attack or increase blood pressure. Premenopausal women. Letrozole should not be taken by women who have not reached menopause, either naturally or surgically, unless the potential benefits outweigh the risk. Okay. That's very interesting. My mother's blood pressure is okay. She does take meds for it, but it's okay. That's something I should tell her. Okay, is weight gain a side effect of letrozole? Weight gain is one of the occasional side effects that can occur when taking letrozole, but if you are finding it difficult to control, then it may be worth getting in touch with your doctor to let them know. Okay, that's important. That's a good one. I mean, her weight is good. It's a healthy weight. Very healthy weight, my mother. So what I learned so far, it can induce weight gain. It can make you achy, dizzy, raise your blood pressure. Okay. Okay, back pain. I'm just skimming through this. Can letrozole shrink tumors? That's important. Let's see. Letrozole, however, was very effective in these types of tumors, shrinking them in 88% of women. Several upcoming studies will compare letrozole's effect to tamoxifen in larger numbers of breast cancer patients. Okay. Can letrozole cause cancer? Oh, very good. Another good question. Can letrozole cause cancer? Let's find out. Estrogen stimulates some breast cancers to grow. These breast cancers are called hormone sensitive or hormone receptor positive. Letrozole can stop or slow the growth of these cancers. Letrozole only works in women who have had their menopause. Okay. Okay, this is another good one. Does letrozole increase cholesterol? Very good question. Let's see. The LDL cholesterol level increased non-significantly in the first 6 months, decreasing thereafter to the pre-treatment level. A low trend in elevation, a beneficial side effect, was found for the HDL cholesterol level after letrozole. There was no significant effect of letrozole treatment on the TGL level. Okay. Does letrozole cause bone loss? That's a good question. But this is not usually noticeable. Any cancer treatment in women that lowers estrogen levels can increase the risk of osteoporosis. Hormone therapy with a drug called an aromatase inhibitor, radiotherapy to your ovaries to stop them working. Okay. I think helps. I'm just seeing here. Okay, can a Schumer's drink? Okay, so what I'm going to do now, okay, I'm glad I read that. So now I'm going to to read up on this other drug, tamoxifen. Okay. Let's press on, let's see. Okay, let's press on that. Okay, these are the other names that tamoxifen is known as. Novartis and Soltamox. Okay. Tamoxifen is the oldest and most prescribed selective estrogen receptor modulator, known as SERM. Tamoxifen is approved by the U.S. Food and Drug Administration to treat women and men diagnosed with hormone receptor positive early stage breast cancer after surgery or possibly chemotherapy and radiation to reduce the risk of the cancer coming back. Women and men diagnosed with advanced stage or metastatic hormone receptor positive disease. Okay, it's also used to reduce breast cancer risk in women who haven't been diagnosed but are at higher than average risk for the disease. Okay, tamoxifen won't work on hormone receptor negative breast cancer. So interesting, you have breast cancer, but not all breast cancers are hormone sensitive or hormone positive. This one, it could be, you could have, hormone receptor negative breast cancer. So that's very, very interesting. Very interesting. So yeah, they're saying different things could cause cancer. What induced it? Okay. Okay, most doctors recommend taking tamoxifen at the same time each day. You should not take tamoxifen if you are breastfeeding, pregnant, trying to get pregnant, or if there is any chance that you could be pregnant. Tamoxifen may cause damage to developing embryos, blah, blah, blah. Okay. So let me just pass that. She's not going to be breastfeeding. Benefits of tamoxifen. Since it's approved in 1998, tamoxifen has been used to treat millions of women and men diagnosed with hormone receptor positive breast cancer. While an aromatase inhibitor is the first hormonal therapy medicine choice for postmenopausal women, tamoxifen is the first choice for premenopausal women and is still a good choice for postmenopausal women who can't take an aromatase inhibitor. This drug can reduce the risk of breast cancer coming back by 40 to 50% in postmenopausal women and by 30 to 50% in premenopausal women. Okay. It reduced the risk of a new cancer developing in the other breast by 50%. Shrink large hormone receptor positive breast cancers before surgery. Nice. Slow or stop the growth of advanced or metastatic hormone receptor positive breast cancer in both pre and postmenopausal women. Lower breast cancer risk in women who have a higher than average risk of cancer of disease but have not been diagnosed. Tamoxifen offers health benefits that aren't related to treating cancer. Okay, while tamoxifen blocks estrogen's actions on breast cells, it activates estrogen action in bone and liver cells. I'm not sure what that means. While tamoxifen blocks estrogen's action on breast cells, it activates estrogen's action in bone and liver cells. Okay. So, I'm not sure what that means in this context. Help stop bone loss after, interesting. Tamoxifen can help stop bone loss after menopause, lower cholesterol levels. Interesting. Okay, reason some people may not get the full benefits of tamoxifen. Okay, that looks more technical talk, so I'm not going to even attempt to read that. Okay, anything else? Okay, here's a good question. Medicines to avoid while taking tamoxifen. Okay. Let's see. In the list below, the medications under the heading strong inhibitors and moderate inhibitors can inhibit blah 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 and interfere with the effectiveness of tamoxifen. Okay, let's just read the names. Let's see. Yeah, I'm not sure what she's taking. Okay, so some of the names I recognize, but these are some of the names. So I'm going to share this information. So once this video is up, you can just, put the video on pause and find out what your loved one, what medications they may be taking, and so you'll be able to ask that person or go with them to the doctor to find out what which medications they're not to take with this. So I have to find out what medication she's taking, if she's taking any of these. Okay, side effects. Okay, tamoxifen's selective estrogen activation effects can cause some serious side effects, including blood clots, stroke, and endometrial cancer. If you and your doctor are considering tamoxifen as part of your treatment plan, tell your doctor if you smoke or have a history of blood clots or heart attack. If you're taking tamoxifen, call your doctor immediately if you have any of these symptoms. Wow. Vaginal bleeding or discharge, pain or pressure in the pelvis. Wow. Leg swelling, chest pain, shortness of breath, weakness, vision problems, dizziness, headache. The most common side effects of tamoxifen are bone pain, hot flashes, nausea, fatigue, mood swings, depression, headache, hair thinning, constipation, dry skin, loss of libido. Hot flashes or night sweats from taking tamoxifen can be troubling. Blah, 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 blah. This is a good question. How long do I take tamoxifen? Newly diagnosed premenopausal and perimenopausal women. Okay, that doesn't apply here. Let's see. Postmenopausal women could take another 5 years of tamoxifen or switch to an aromatase inhibitor for 5 years. Okay, newly diagnosed postmenopausal women have several options. Take tamoxifen for 10 years, take an aromatase inhibitor for 5 years. Right now, there isn't enough evidence to recommend taking an aromatase inhibitor for 10 years. Taking tamoxifen for 5 years, then switch to an aromatase inhibitor for another 5 years. Okay, so what they're saying there in short, okay, this tamoxifen is not an aromatase. That first one was that letrozole. So they're saying, I guess you can take this tamoxifen that you see here for 5 years, and then you switch over to, in this case, it could be the letrozole, if I understood right. But again, you would contact your primary care physician to find out definitively what that means. Okay, but it's good to know. But I don't think my mother would be living 10 more years. She's 90 years old and her memory is going, so I don't think she'll be living 10 more years. But that'd be great if she does. That would really be great. And if she has her full mind, that'd be wonderful. Okay, let's see anything else. Excuse me. Okay. Let me go back. Let me see anything else. Let's see. Okay, let me see this. Okay, let's see how effective it is. Okay. Tamoxifen were shown to be more effective at reducing recurrence risk in postmenopausal women and are now used more often than tamoxifen to treat women who've gone through menopause. Most women take hormonal therapy for 5 to 10 years after breast cancer surgery. Both tamoxifen and aromatase inhibitors can cause side effects. Yeah. Okay. Okay, so even though it seems to, it's saying here that the tamoxifen is more effective at reducing recurrence risk in postmenopausal. But let's see. Let's see. Okay, it's kind of confusing here, because this is tamoxifen. It says are now used more often than tamoxifen. So I'm not sure what they're talking. This whole section is on tamoxifen. So how could something be more effective than itself? I don't know I don't understand what's happening there. Okay, let's see what else here. Yeah, I think this will make you tired here. When you start to take tamoxifen, you may feel tired, drowsy, or feel like you have no energy. Okay. Wow. My mother starts to feel very tired lately. Sometimes she just, she wants to sleep, take her naps. Yeah, so maybe that one may not be the best, the tamoxifen. It seems like it has, they both have negative side effects. but it sounds like the tamoxifen has even more, the uterine bleeding, and the tiredness. Very interesting. Let's see. There's something I want to check since I have you guys on the line. Let me check something else. A couple of years ago, I think it was 2012. So, someone told me about this cancer treatment, and it's what do you call it? It uses amino acids. Let me just type in something. I forget the name. They use this. It's supposed to be used to treat cancer, to remove the cancer, and they do the practice in Mexico. Something with what is that? Let me write down the word amino acid therapy for cancer. Let's see. Thanks for natural cancer cures. Okay, it's an advertisement. A lot of advertisement. Let's see. Control amino acid therapy and cancer. Cancer therapy advisor. Let's see. Control amino acid therapy. Let's see. Cat. Memorial Sloan Kettering cancer. Let's see. And press on that. Disclaimer. What is that? By clicking continue below, I accept all the above terms. I'm not gonna even try that. Let's see here. I know. Let me do amino acid therapy for cancer in Mexico. Hopefully I can find the name. Cancer treatment in Tijuana, Mexico. Alternative treatments of South. Cancer treatment in Tijuana. Alternative treatments. And there was something else. Apricot kernels. Apricot kernels. It was illegal to sell apricot seeds. You heard me right. The kernels of an apricot, the fruit that you eat. You can sell the fruit, but you can't sell the seeds, the kernels. It has I forget the name, but it is a toxin, but the toxin is attached to this other molecule. And but it stays together. But if it's separate, then of course this toxin can kill somebody. But even like table salt, chloride is very toxic, but sodium chloride which is table salt, doesn't kill you if you just eat it, So some things, yes, if you're able to pull out the components of it, it may have some dangerous chemicals, but when it's eaten as its whole, maybe I'll buy my mother some kernel seeds. Yeah. Let me see here. let me. I'm trying to find the name of the drug. Okay, natural cancer treatments providing hope and healing. Okay. Yeah, I want to try to find the name of it. Wow, look at 3 weeks of treatment, $18,000. Wow, here's some survivor stories. Enzymatic cancer therapy. Oxygen therapies, intravenous. Vitamin and mineral supplements, various dietary supplements to help patients fight cancer and enhance their quality of life while undergoing cancer treatment. Oh, definitely. Definitely. You're going to, because she most likely, my mother, will take radiation therapy. And so here it advises vitamin C, vitamin D as in David, etc. Let's see, let me go back a page. Let's see that. Amino acids and breast cancer. Let's see. Let me try that. Oh, this is more scientific. Okay, I'm not going to read that. At least not now. Okay. Oh, let's see this. Amino acid. I'm sorry. What is amino treatment for cancer? Let's just see. A controlled diet that restricts certain amino acids could be used as an additional treatment for some cancer patients, according to blah blah blah. Found that removing two non-essential amino acids, serine and glycine, from the diet of mice slowed the development of tumors. No, the thing that I'm talking about, it's these amino acids that I think they actually injected in you. Well, I learned about it in 2012. And they said it was very effective. Oh well, I'll probably have to do more research on that. Let's see. Yeah, I'll probably have to do more research on that to really find out about the different therapies. Yeah. Yeah, it's really something that today, I mean, today was okay today. It was it was raining. It started pouring when we were about to leave the clinic. It was pouring real hard. And after we went to the yeah, I was going to say earlier, me and another family member were in the room with my mom, and we watched the male doctor examine her breasts, and I have to admit I felt uncomfortable. I didn't. I see that it was like a little triggering for me, meaning that it gave me, made me feel very anxious. Things that have happened to me in life, so sometimes certain things that I see might um, trigger a memory on things from my past. So I'm there. The doctor was fine. The male doctor was fine, but I see with me, at that moment, I started to feel uncomfortable, and I guess maybe because it was my mom, that little component seen someone else as not your father, even though it was strictly just him doing an exam. But I see that it gave me some anxiety. What I do like about the visit, that we were all there, and the doctor and the nurse, they were nice. The nurse was very reassuring, and she gave compliments, and it was nice. She she was positive this visit, and let's see. I'm glad that we all came, because I think with when all everybody's there, it gives you a sense of empowerment. And my mother is very lucky that she has children that are with her and that will be by her side. And I was talking to my mother the other day. Yeah, I went by to my mother's house yesterday evening, and I I mean, not to say what was actually discussed, but you want the best for your loved one. And she was getting a little upset with me. And then I said, I told my mom, I said, you are so fortunate that you have 7 children, and here you have your children come by and watch over you and are concerned. Some people have no one. And, I'm not married. I don't have children. And I told my mom, I said, if I'm fortunate enough to reach the age of 90, I said, and this is truth, I said, I pray now that if I reach my mother's age, I pray to the universe that they'll send someone to me, that so I won't have to, be alone about health matters. The natural age process, and you're living, because as you get older, you know certain things you don't have the same abilities, and you can fall. Anything could happen. So I was getting, I have to admit, I was getting a little edgy. I said, count your blessings that we're here to tell you, hey, you need to get, X, Y, and Z done. We're here to be your support. And I'm thinking, look, I don't have anyone. And she might be getting upset with me, but, count your blessings. Some people have no one. And yeah, I sometimes I feel a little vulnerable like that. But I did pray to the universe. I said, that it'd be a peaceful transition for me. Yeah, I do that. I've said that. When you got the breath of life in your lungs, as the Creator to be very merciful to you when that time comes. Yes, I said, let me grow old gracefully. That's what I told the universe. I said, please, yeah. So that's all I can really think of right now about this journey, and after the exam, excuse me, it's the ear is tickling my nose, I'm sorry, that we went out to get some pizza, and we went to an area near where my mom lives, and we had some pizza, and it was nice. There was a man there. He's from the area. He said he was raised in the 1960s. He looked about my age, and he's an old school Italian looking man. And here me, a black girl from Queens. And here in the past, we, culturally and historically in this part of town, we really didn't mingle. But here was nice to see old school, so to speak, that we were able to talk and reminisce. We would talk about pizza and how, the pizzas are changed and everything. And it was really nice. It was really nice. I see that this whole life process, that when you're younger and the politics of the past, and it felt real to you, and then now you get older and you start to think, all that stuff of the past, the 60s, the 70s, the 80s, it really, it's almost like a play, like it's a show, you're watching it. And maybe you lived it, you were in that play, but it's not really real, you know. It's just a weird feeling. And so I think all this process, you know, the getting older process, we all, if we're fortunate, you know, we're all going to get older. And that's also why I'm doing this, you know, started this channel, because it's something that you can't avoid, and I don't want to run away from it, from the topic. I want it to be a natural thing. I don't want to be afraid of it. And in fact, to embrace it, to embrace the transition process. So this is also why I'm doing this, this channel. And to, because it's about me learning, and you learn from others. So the more you learn about a subject, the less mystifying it is, because I was petrified of death, petrified, scared. But I don't want to be afraid. This, I'm about empowerment, and society teaches us certain things. But when I look around in life, that change is happening every second. Every second we are changing. From the time we're born, we are pursuing our sunset. And that's also why I named this channel Sunset Journey. Because, you know, I've been to funerals with family, and it's very common that in the black community, the I forget what you call it, um, the paper that you get, and it often says sunrise when the person was born, and then sunset the day of their passing, you know. And so yes, from when you take that first breath, it's actually a sunset journey that you're going to have. It's just somebody's sunset. Some sunsets are long and some are short. So embrace it. And because I see now, I'm learning now that life isn't over when your body goes, because your spirit, I believe this. And I believe this because I've been doing what they call, what do you call it now? Meditating. Yeah. I've been doing I don't do it as often as I used to. But yeah, I was experiencing different things during meditation. And I'm learning this physical world is what's really distracting you. This physical world it's not it's so temporary. But that other dimension that you experience when you do a meditation, that's real. That's more real than this physical plane. Yeah. There are other things. Your mind, your consciousness doesn't die, they say. And I believe that. And that's helping me overcome the fear, you know. So, why, I can't think of anything else. Can't think of anything else. But yeah, so this is video number 2, my first live stream for this channel, Sunset Journey. And may I continue putting them up there. So when I have like another meeting with my family member who has the breast cancer, I'm gonna go home and like a report and talk about my experience with this this process. Okay, so I thank you guys and gals for watching. And yes, so if you, those people who are going to watch this video, if you have any information about the different treatments for estrogen induced breast cancer, and alternative treatment plans, uh, let me know. So you could write it in the comments below once this live stream uploads. And yeah, tell your friends about this channel too if you think that they would like this discussion. Yeah, because I also do this channel to reach out to ladies or even men who might be faced with this dilemma, a family member or themselves. And so to hear another human being talk about their experiences, so it's to give a sense of community so you're not alone through this process, okay? So I thank you so much for watching, and yes, so until next time soon, okay? Bye bye.